We are the Chicago Partnership. I'm your host and friend, Ashanti Petaway. I'm excited to have you with us today. And for those of you who may be unfamiliar with us, the Chicago Partnership is a multicultural, multi-denominational team of leaders. And we're all from the local churches found here in Chicago with one common mission, and that is to literally make Jesus visible to every neighborhood in Chicago. We partner with leaders by offering training. We have a unique 2-year actual leadership cohort program that we've been doing, and it's been wonderful. We work to equip them with teaching, coaching, network of peers to be able to build with and grow with. And then we're also very intentional of partnering with the local churches to offer pastoral residencies, help raise funds and supports for local church planners, as well as revitalization efforts. And we come together to serve the city through our benevolence arm, the Chicago Delivers. Finally, we are partners with local organizations to really amplify and promote the work that is being done throughout the city of Chicago, as we are the hands and feet of the gospel, and to kind of change the trajectory of what we often see on the news and give a different dialogue on what's going on in Chicago. Through our leadership cohort, Chicago Deliver, and events like today, TCP Presents, we hope to provide like just a common table of a spirit-led conversation, collaboration, connection and network, so that we can work together to literally, like I said before, make Jesus visible to every neighborhood in the city of Chicago. So we welcome you and are thankful to have you with us today. I am a privilege because as we have this discussion on faith, COVID-19, and all this pandemic has done to us, is forced us to reevaluate a lot of things. But I'm thankful to have two well-learned men before us. We have Bishop Horace Smith, Bishop and Dr. Horace Smith. He's the pastor of Apostolic Faith Church and attending physician specializing in pediatric hematology and oncology at Ann and Robert Lurie Children's Hospital of Chicago, formerly Children's Memorial Hospital. Dr. Horace E. Smith has treated bodies and souls for more than 40 years. And then I have a new brother of mine that I've just met, Dr. Burley, but we have a special bond. Morehouse is in the house.
Oh, Lord.
So definitely got to represent. Won't go too hard, but thankful to have him with us. He's the founder of The Cure. I feel like I just messed that up, Dr. Brother. You can correct me. A consulting company, and is in the intersection of faith, health, and human rights with expertise in HIV and AIDS. Ulysses has served as a member of the executive committee of the World Council of Churches, as well as the United States Presidential Advisory Council on HIV and AIDS under the Obama administration. He is currently working with Faith Community Engagement Ambassador for the COVID-19 Prevention Network to connect with faith communities to share evidence-based information regarding COVID-19 and vaccines and antibodies being developed for its prevention. So we welcome both of you gentlemen here today, and I'm glad to have you with us. As we open this conversation, just would kind of like you guys to give us some insight. I mean, we've heard, of course, tons of things on the news. We've heard various facts. We've had questions as far as what those facts really are. But on the simplest level, could you kind of just introduce what is COVID-19 and what has made it so much different than the flu or any previous strands within its form? And I'll leave it to either one of you gentlemen to start us off.
Sure, I can get started. So first of all, let me thank all of you for the invitation. I want to thank my brother, Reverend Di, for inviting me to be a part of this conversation. Ashanti, for your organization, and Bishop Horace Smith, somebody who I look up to as somebody who has really integrated public health and faith in a way in which I hope to emulate in my career. So thanks to all of you. Again, I am the founder of The Cure, which is an organization where we treat people and not just disease. And most of my portfolio has involved HIV and AIDS work, but with the emergence of COVID-19 disease, I had to make a shift to meet the need of the current pandemic. To your question, Ashanti, coronaviruses aren't anything new for us. They make up a large family of viruses. Many of the common colds that we experience are coronaviruses. But this particular COVID-19 disease is the result of a novel coronavirus, SARS-CoV-2. SARS standing for severe acute respiratory syndrome. If you all remember, there was a SARS pandemic in the early 2000s, around 2002, that wreaked havoc on certain regions of our country. And then about 10 years later, there was another outbreak of MERS, Middle Eastern respiratory syndrome, right? Those were all coronaviruses. And we now know that there's a lot of overlay between SARS and SARS-CoV-2, hence the name SARS-CoV-2. So it's SARS coronavirus version 2, if you will. It's a version of this coronavirus that we've never seen before. It's one of the 7 coronaviruses that we know infect humans. It's a zoonotic disease, and so that means that we believe it emerged from an animal species and at some point jumped into the human population. And we are now over a year to a pandemic where we are still learning about the disease, something new every day.
Wow.
Yeah, I think that's a great, thank you, Dr. Burley. Good to see you.
Likewise.
Yeah, that's a great introduction. And I think that the application of what he just said to all of us may be this, and this is a novel virus. I think that we often forget about that. The word novel means that no human being, until it, as he said, jumped from an animal to human species, had ever been exposed to it. So when you talk about why it's different than flu, there was no human being until 2019 that had been exposed to this virus. I'll go a little bit ahead of myself. People talk about the strength of their immune system. This has nothing to do with the strength of your immune system. Your immune system responds to a foreign object that you've seen before. So if it's a novel virus, there is no human being until the first one was infected was ever exposed to it. That's why it is so virulent, that every human being, it's a true pandemic, that every human being, if you're exposed to it, you're going to probably get coronavirus, or really COVID-19. I think one of my sermons back in March, when we talked about the issue of the vaccines and skepticism, you're going to either get coronavirus or vaccine. One of those two is going to happen because you don't have protection. It's nothing to do with a weak immune system. It's any immune system exposed to a new pathogen is going to contract it. So the kind of dovetail to what we're going to get into about the vaccines, unless there's another way to develop an antibody against this new virus, you're going to have to get a vaccine. So I think it helps us to understand the issue of novel virus and the issue of true pandemic. It means every human being is vulnerable.
I think that's very, oh, go ahead, Dr. Burley.
Yeah, I was going to add to that. You mentioned how it might be different from the flu. And, early on in the pandemic, you heard people say, oh, this isn't much different from the flu. And then quickly we realized, well, that just wasn't true. We know first and foremost that the death rate for flu is about 0.1% that of COVID-19. And so that means SARS-CoV-2 is 10 times deadlier than the average flu strain. And usually within a flu season, there are at least 3 or 4 different circulating flu strains, right? And so the vaccine that then becomes available for that seasonal flu usually includes 2 types of influenza A strains and maybe 1 or 2 types of influenza B strains, just to cover what had been circulating during the winter in the Southern Hemisphere, which is contrast with our seasons. And so we know that it's deadlier. We know that it's more transmissible, COVID-19, in terms of its ability to spread. And it's novel, right? And so as Bishop Smith mentioned, influenzas have been with us for centuries. And while novel strains arise like H1N1 that we got in 2009, that strain is still circulating, right? But that caused, for a brief period of time, a global pandemic. And so, but because of that, there's still overlay from each influenza strain, right? And because it's always been with us, or it's been with us at least for this generation, our bodies have been exposed to it on one level or another. And so our body then has some memory, immunity, if you will, to fight against influenza even in the cases where we might not get vaccinated now, we still encourage everyone to receive each year's influenza vaccine, particularly now, because you don't want to confuse SARS-CoV-2 or COVID-19 disease with the flu, because not acting on your illness, thinking it might be the flu, might lead to a deadlier consequence if in fact it's SARS-CoV-2. But they're certainly different. The viruses are different. Influenza is very much so different from a coronavirus. They're both respiratory diseases. They're both transmissible diseases, but they definitely have different pathologies in terms of how they impact one's body and how they burden our healthcare system, right? Because that's a part of the conversation as well, in terms of the number of people that are just sick, not necessarily the number of people who have actually died, but how many people are getting sick and then continue to suffer with these long-term consequences of this novel virus. So they are not the same. They are not created equal. And one of the things that we've been advising people, if you're not willing to consider a COVID-19 vaccine, maybe this is the year that you consider the flu vaccine at least. So at least you can be protected from influenza, which then might make you more vulnerable to COVID-19 infection.
So for those who are still wrestling and processing through this and just curious of the process, as we look at this and the information you've given us in regarding the flu and how there's a significant difference between the two, is there an element where we are just going to have to learn to live with COVID-19? Or is there a time where you think it no longer is really a significant issue, or the pandemic level goes down significantly?
Yeah, I think the most honest answer is we don't know.
Yeah.
And you might hear me or Bishop Smith say that a lot over the course of this conversation. They're just things that we don't know yet, and time will tell. A year ago, I would make comments like, COVID-19 will end, but when it ends, we'll have to decide how we prepare for the next pandemic moving forward. Now, I'm not so sure if COVID-19 will end, right? Some people are making statements such that this might be something that we have to learn to live with, maybe in the same way in which we've learned to live with influenzas, to where we have to be, vaccinated continuously throughout our lifetime. We're just not sure yet. The hope is that the vaccines that have been created for the prevention of COVID-19 disease, that they'll have some lasting immunity. Best case scenario would be the kind of vaccine that produces, an immune response like smallpox, where you got vaccinated for it and you never had to worry about it again. You had this lifelong immunity, right? But that was a different platform in terms of the vaccine that was administered. It was a different virus. That would be best case scenario, but it's really yet to be seen. Time will tell. We'll continue to monitor and study those who have both been infected with COVID-19 disease to see what their immunity looks like, outside of their infection, but to also follow people who have received vaccines to see what the coverage of those vaccines might look like months and years from now. It's just yet to be seen.
And I'm curious, Bishop Smith, in your line of work, you've been doing this for quite some time, even though you still look very young.
Thank you.
What has shocked you the most in light of COVID-19 and just kind of what you've seen at work, to kind of give a more hands-on perspective of like what it feels like in your field in light of this?
Yeah, I'm not sure in just in my field of medicine, but even in ministry, we have to admit that this is, let's go back to March. Back in March in the city of Chicago, I think the officials were kind of overwhelmed by what happened with COVID. And what they were most shocked about, they said from the governor to the mayor to others, boy, we're so surprised at how many people of color are getting this disease in a serious way and dying. And I said to them on one of the state shows, why are you surprised? I'm not surprised. And this involves the church and its issue of equity and justice. It doesn't matter any negative, It could be a disease, it could be economic, it could be sociologic. If there is a population already under duress, I will guarantee you as a physician that the prevalence of a disease and the incidence is going to skyrocket among those people.
Mm.
So I think that, and I've said to our officials recently, as we ramp up the heroic work biologically against COVID-19, and I believe we're going to have vaccines that are going to bring it under control. We're going to be able to live a normal life with some caveats. But the issues of what's happening in our society are not addressed because we, in an acute way, deal with the biologic epidemic, which we must do.
Yeah.
And so we've got to understand that the issue of what's happening is deeper than biology. I've said to people, they've asked me, what is your number one takeaway from this pandemic? I said, I think that it shows us how far we've forgotten our common humanity.
Mm.
When we think that others don't count and we marginalize those people, we're going to pay the price eventually. It's like with COVID, you know, if you don't take care of these Black and brown communities, it's going to expose others that are affluent. And so I think that we have to think about it in a deeper way. It is biologic. We must deal with that. But we must also understand that if we don't deal with the entrenched issues of our day, this pandemic is just one. And as Dr. Burley has said, we're going to see more pandemics biologically. We're going to see more pandemics like the issue of injustice and poverty and racism is going to come up repetitively. And we should not be surprised because you can't, I tell my people, you know, we deal with people with cancer, you know, you can't treat, if you have cancer, your fever with just Tylenol. The temperature will go down for a while, but the cancer is still there. So I think we've got to, expand our thought about this and understand that underlying issues also drive this disease.
That's really good and helpful. And in light of that, thinking about all the disparities we've seen, it has highlighted in the midst of a season where the nation has been under a lot of duress when it comes to racial tension and things going on. It's shown the disparity greatly. So with that, I think it's a perfect segue into the question that many in the minority community, African-American, Latino, is that can we trust the vaccine? Because there's always been this fear of how science or the medical world has not dealt with our communities well. So many people are like, I hear you say take it, but I don't know if I can trust that. I don't want to be a test dummy.
Well, you know, I want to jump into that because I think, and again, time is the issue here. I understand skepticism. I know the background of Tuskegee. I know the issues of what happened with many of our clinical trials 50 years ago, that they were not conducted with integrity. They were not conducted with ethics. That is not the case today, but I'll say this. We already know that certain populations are more prone to get COVID. That we know. Mm. We know that yesterday in this country, 3,000 Americans died from COVID. Mm. Today, 3,000 Americans are going to die from COVID. Worldwide, 8,500 people are going to die from COVID. We know that. The vaccines are both safe and effective. And in light of the picture of death, I would say that to those who are skeptical, you may not know about the vaccine, but you do know about people dying, and that's not made up. So when you see such a huge number of people getting virulently sick, a long-term disease in their lungs, diabetes, heart disease, you know all these things. And so even with skepticism, I would say to the skeptics, if I'm skeptical, my job is to do research and get the facts. I say this all the time, and I want to be short because I want to hear the questions. Your fear will not protect you from COVID. Your fear will not keep you from dying. And too many of us know that's the case. I know of preachers who got in the pulpit and said, I don't believe in COVID. I don't believe in masks. And some of them are dead. And I'm not happy about that. But the point is that Jesus said, know the truth. Truth makes you free. And you can discover the truth. Just look around you or do the research. People, last thing I'll say about this. So as of today, 43 million Americans have gotten COVID-19 vaccinated. 43 million have gotten at least their first shot. Worldwide, 145 million people have gotten COVID-19 vaccines. They're not dying. And I'll say this, if the 3,000 who died yesterday had been vaccinated, I guarantee you, 95% of those people would be alive today. So skepticism, I understand it, but if you delay, it means lives lost. That's just the unfortunate truth.
Okay. Dr. Burley, did you have any insight there you want to share? I saw you giving the nods.
Yeah, no, I think Bishop Smith is absolutely right. I think there's a human component to this, right? Outside of the medicine and the science. Mm-hmm. As we approach the season of Lent and Ash Wednesday next week, we don't need any more reminders of our mortality, mm-hmm. right? I think the emergence of a vaccine and the amount of record-breaking time that we've experienced, which, by the way, was not necessarily a barrier, right, to receiving the vaccine. A lot of people waved that flag around, oh, it's done too fast. So steps were skipped. We know they weren't. We also know that the technology that has been used to develop the vaccines, at least the ones that are now available to us here in the United States, this technology that has been used and researched for over 30 years now. It just took an emergent public health crisis for us to finally allow that technology to be experienced by the general population. And that has been largely to our advantage. And so if not for that technology, we would be years out from a viable vaccine, and many more millions of lives would be lost. And so we don't have to experience that. We don't have to endure that. The other thing is, I'm certain that all of us on this call, barring those who may have had some religious exceptions, have received vaccines in our lifetime, whether it's children or as adults. And we generally don't much worry about what was in those vaccines or how they've impacted our lives, because we don't have to, because those vaccines have largely protected us from worry, if you will, from worry of, measles, mumps, rubella, from worry of chickenpox, from, I'm still old enough to remember having gotten chickenpox, right? Yeah. And so now we have a vaccine to make sure that you don't have to endure that. And so science is God-given. And I think that there's a lot of overlap between faith and science. People always ask me, how do you straddle the line? And I say, well, there is no line for me. I think both of them have the core tenet of extending life, preserving life and life abundantly, the sanctity of life, right? That's what faith is about, and that's what scientific research is about. We've literally witnessed a medical miracle, if you will, over the last year in terms of what we've been able to accomplish scientifically, but it won't be enough because there's a social component to the disease, as Bishop Smith laid out, these social determinants of health, right? These social ills that make us sick. And you can't cure those ills in hospitals or laboratories, right? You have to cure them in community. You have to cure them in churches. You have to cure them with policy and humanity and empathy. And those are things that we have largely lacked over this last year, if I will. Now, let me say, I've seen far more people show compassion to their fellow neighbor than not, but I've seen far too many people not be empathetic to their fellow neighbor by doing something as simple as wearing a face covering, a piece of cloth over your face, or being willing to distance yourself or wash your hands. And so, I think even on the other side of COVID-19, whatever that looks like, we have to have some hard conversations as people of faith and goodwill about how we treat people and not just disease.
Mm-hmm. Again, we thank everybody who's tuned in right now. We are accepting your questions, so feel free to shoot them in the chat. I'll definitely try and get to as many of them as possible. There is one thing I wanted to kind of have you guys reiterate for clarity, and that was you spoke of kind of how the speed of the vaccine was created, and that a lot of the things technologically that were used is not necessarily new technology. So please let me know, is this a fair assessment of what I receive when I hear that? The technology that is currently available that was used to get the vaccine done has existed. There have just been things that in the past maybe slowed up the process of the vaccine being produced, that the significance of this pandemic actually kind of helped, I want to say, get rid of the red tape, but get rid of some of the bureaucracy that might have held it up in the past. Is that a safe assessment, or?
Well, so there's a number of things about science. So sometimes science can be slow, but I often say the only thing slower than science is the church. No offense in terms of evolving and being innovative, but if you look at
me now with questions they got to say.
if you look at historically the emergence of a novel disease and then the production of a vaccine against that novel disease, on average, it's been years, right? To give perspective, we're 40 years this year into at least the discovery of the HIV and AIDS pandemic, still the deadliest pandemic of our lifetimes. And it was just within the last 20 years that we've been able to explore the possibilities of vaccines, and we're closer than we've ever been now. But that's ahead of schedule for a lot of these novel diseases that we've combated over time. Science is also such that if it ain't broke, don't fix it. All right. So the way in which we were able to develop vaccines in the past worked very well for us. And we were able to take the time to invest, to test, to discover, such that it would have paid dividends, some years down the road, to where we can now say we have almost a polio-free society. We have a smallpox-free society. We were close to a measles-free society, but current anti-vaccine movements have kind of backtracked that. So it's not necessarily that there was bureaucracy involved. It was that the current way of developing vaccines wasn't necessarily broken, but it was time consuming. And time was one thing that we didn't have in responding to this particular pandemic. The mRNA technology requires only that we have the genetic sequence of the virus for which we're trying to protect against. And as you all know, we were able to sequence the entire human genome, a couple of decades ago. And so because of our advancement in genetics, we can now, sequence the gene sequence of a virus at the snap of a finger. And so, COVID-19 emerged in, the end of December 2019. By the beginning of January, that virus SARS-CoV-2 had already been sequenced, and researchers went right to work. And because mRNA vaccines, genetic vaccines in particular, only require that you have the genome of the virus, they were able to plug that sequence in, and by the end of the week, they had a vaccine candidate. Because mRNA vaccines don't require the harvesting of eggs and the growing of vectors, if you will, things that we have traditionally used to deliver the package of the vaccine into the body's cells, right? That took growing eggs and a long incubation period. That incubation period doesn't exist with mRNA vaccines. And so now is the time to reveal that science for its broader use. And I'm just grateful that people have been working on it for many decades before.
Yeah.
Let me throw in the elephant in the room about that. The real dynamic, and what Dr. Burley said is absolutely correct, is economics. It's simply money. So when the U.S. government says to 4 or 5 different companies, I'll give you $2 billion up front to develop this vaccine, you can hire people to work 24/7. Usually for these companies, they risk research dollars, millions of it, to develop a product that may not be effective. Our government, to its credit, gave them, and one company, I won't mention the name, built their factories for them and paid their employees and took out the economic risk. They guaranteed them the money, even if the vaccine wouldn't work. So we had the genetics, we had the technology, we didn't have the personnel and didn't have the economic incentive, but very quickly we did, and the government came through, and that's why they were having people working 24 hours a day. They were guaranteed the economic benefit by our government, because our government realized if you don't do that, if you delay it, people are going to die by the millions. And so the economic fear, Pfizer, Moderna, and the others didn't have it. They were guaranteed payment up front. And so it took out the economic risk. So I'm not surprised they got this, Dr. Burley, I was working with HIV with kids with hemophilia when we didn't know what HIV was. Yeah. The reason we don't have a vaccine for HIV, one of the big reasons, it is not economically defensible. And that's just a harsh thing. So it's slow to develop, because you may put all your money into this development and the people who need it can't pay for it. So again, let's be honest in America, the economic incentive and the economic risk was removed, and these companies ramped up and got these vaccines out to us. Thank God they did.
All right. Absolutely. Yeah, that's a very helpful perspective, because for the average American, the average person, that's foreign to us and not even recognizing that that's taking place. We have received a couple of questions. One that I'll kind of bring together is one is this: is what are some of the negative consequences of taking the vaccine, if any? And is there an element where if you've already contracted it, is it even necessary to take it again? Or I shouldn't say take it again, to take it since you've contracted it and lived through it.
Yeah, I'll jump in there. Dr. Burley said there's some things we don't know, and let's put things in perspective. What we do know is the death rate from COVID-19. That's on this side. What we don't know is, could there be long-term effects of the vaccine? Of course, there could be. The persons in the clinical studies who got the first dose of vaccine have only been studied for about 6 to 8 months. So we know about 8 to 9 months out the issue of side effects. Could there be long-term? There could, but usually with vaccines, you get the greatest reaction in the first few months, first couple weeks out. Now, doesn't mean you can't have long-term effects. But again, what we do know is that without those vaccines, death is a real issue. It's not a fear tactic, it's a real issue. So we didn't have the luxury to wait for 2 or 3 years to study all these persons to guarantee in 2 years there'd be no side effects. So we don't know some things. What we do know is that we can stop this virus. I think yesterday Israel reported they probably are the most westernized country with the greatest number of their people vaccinated. They reduced over 3 months the prevalence of COVID by 41%. Those are real numbers. So again, could there be long-term effects? There could be. Dr. Burley made another point about that. 2 months ago, when I got my first shot, about a month and a half, my nurse said to me, aren't you afraid? I said, no. I said to them, about 10 of them, I said, how many of you ever got a vaccine in your life? I said, how many, does the average person in America, how many vaccines have you gotten? At least 30, at least. I'm old enough, I'm old, Dr. Burley. I remember polio. I remember people who had polio. I remember people who had these diseases that we never see today. When do we see them? Vaccines. Vaccines as a medical therapy is the greatest benefit to humankind than any other intervention that we know about are vaccines. That's why you don't see these things. But when you start not getting vaccinated, as Dr. Burley pointed out, we're now seeing in kids, measles, meningitis. We hadn't seen that in 30 years, but people stopped getting vaccinated. So vaccines of their natural usage are great. This one has to be one that's a little bit different. I understand fears, but again, there is right now, these 2 vaccines have been approved. They have not really been approved. You do know that. We call emergency authorization. That means if there's a situation where there's no proven medical intervention, you can, in an emergency situation, approve these vaccines as you continue to study them. So again, the question is correct. We don't know long-term, but we got to stop people dying and getting long-term disease. That we do know. So I think we have to put it in some kind of perspective.
Yeah, I'll take the second part of your question, which asks if somebody has had COVID-19 and recovered, should they still get the vaccine? The answer is yes. And so two things. One, we don't know how long the immunity lasts from native COVID-19 infection that we experience from just being exposed to the disease. Likewise, we don't yet know how long the immunity lasts with the vaccine. I'll tell you this, just today, I read a report of a person who recovered from COVID-19 disease from last March. And so almost a year ago now, took an antibody test earlier this week and is not testing for COVID-19 antibodies, IgG antibodies, from having had COVID-19, meaning that at least for the test's sake, they might not have immunity anymore. Now, just because the tests aren't picking up on antibodies don't mean that all protection is lost. But it is to say that now we're starting to see a picture of people who had been infected and recovered from COVID-19 early in the pandemic, who now might not have the same immunity that they would have had maybe 3 months out from infection. And so that's important at a time when now the vaccines are emerging. And so both and sounds great to me, to have both those IgG antibodies from natural infection, and then to have those IgM and IgA antibodies from a vaccine inoculation to be able to protect, in a number of different ways from COVID-19 infection. The other thing is with the emergence of these variants that we've been hearing about, that we know are more transmissible, right? They're more easily spread. Not yet sure if they're deadlier than the strains that exist, but we do have some evidence that because they're more transmissible, even persons who had COVID, the initial strain of COVID-19 previously, their immunity doesn't necessarily protect against these new variants that essentially mutated and evolved to be able to work around any immunity that was developed, right? That's what we do as people. We evolve to our environments. Viruses are living things, they're organisms, and they do the same thing to evolve to ensure their survival. And so, especially in light of these new variants that have emerged in South Africa, Britain, Brazil, here, those variants are now popping up in people's samples here. I think it's more important now than ever to consider the vaccine, even if you've initially been infected with COVID-19.
With that being said, I'm still pulling from, I've got tons of great questions here. I'm going to try my best to get to as many of them as possible. I know we spoke of the need for the vaccine. Someone wanted to ask a question, what do you think is leading to some of the split of thought within the medical field itself, where stories are coming out regarding those who are in the frontline workers, who are in the field, who are refusing to take the vaccine, or saying, hey, we're going to wait until this goes another round or two. Maybe you've got colleagues or people you've spoken to. What are some of the things that are leading to that perspective and them going that route?
Yeah,
I think there's very few people like that. Again, we know that one of the guys who was in the White House as a physician from Stanford today would say to you, you don't need the vaccine, you don't need to have a mask. Unfortunately, he's wrong. So I think that it is overblown how many true scientists at this juncture would refuse a vaccine. We know the nature of this virus. We know that these vaccines, again, as I said earlier, 43 million Americans have received the vaccine. If somebody is waiting, my question would be, waiting for what? Within the next couple of weeks, over 250 million people who have gotten this vaccine. So what are you waiting for? You need more than that. I think that true science, if you look at it, it would be hard to imagine a person saying, there's a, let me be a little bit graphic. Suppose, you were being beat up and robbed by somebody, but you were in a neighborhood. Would you want people to be slow about getting you help? In the immediacy of your danger, you must take action. The problem with I think waiting, it's as if time is going to give you some help. What's going to happen in time to help you if you're vulnerable to something that you have no defense against? I don't see, again, time will not help us. Waiting won't protect us. If you think it does, then just look around you and see in the last 9 months what has happened. We've had more deaths from COVID in the last 4 months than the previous 6 months. 3 months ago was the first time in this country we had 100,000 deaths in a month. And we had not seen that up until June. So the waiting costs us. People are dying I wish we could wait. Even the question about if you've had COVID-19 before, if this was not a deadly disease, I would make a case of, if you've had COVID, I wouldn't take the vaccine. But I know it's deadly because in true science, if I had a disease before, you can measure my blood and see if I'm protected and say, you don't need the vaccine. The problem with that is time is of the essence. And while you're waiting, you may contract it. So, so this thing about, it's like people in the churches often, even though I don't like what Dr. Burley said about the church, it is slow. But we think that time heals things. As physicians, as doctors, we know this, time almost helps nothing. All it does is delay or enhance what's going on. It doesn't, the waiting in an indeterminate amount of time is not going to help us here. We've got to protect from the acute effects of this virus. So I just think that you just can't. Even in Chicago, you saw, we're in Chicago, many of us, the teachers union, one of their issues was that they thought the schools were not safe. These schools are safe. We spent $70 million in the ventilation systems, making sure classrooms had PPE and all that. It was really mainly fear. And then a part of the teachers union said this, to their credit, if you guarantee that you will vaccinate all of our members, then we'll go back. Well, unfortunately, that means if we vaccinate all your members, everybody else can't get the vaccine. People are realizing now, this vaccine is gold. I'll say this, there are companies in Chicago and around this country who have approached Pfizer, Moderna, and all of them, and offered 10 times the amount of the vaccine costs to vaccinate their employees. You think they're stupid? No, they want their employees protected. They want a workforce that's not going to contract COVID. They're willing to pay big money to do it. Wow. And so those who are skeptics are going to be dwindling quickly as they see people who are getting the benefit walking around pretty soon without fear. So I don't think time's going to help us.
Well, that's great. I appreciate that insight. What would you do to, or what can you give to, say, those who are involved right here who are listening? We've got pastors and other lay leaders within the church. What are some things they can do to facilitate conversation or point towards for their congregants who may be skeptical? As kind of like a fact check sheet? Is there a website or organization that you guys could suggest saying, hey, go check out here? If you really want to check this science and be able to see the proof in the pudding, you could go to these outlets.
Yeah, absolutely. As you mentioned in my introduction, I am a member of the COVID-19 Prevention Network, which is the NIH-funded evaluator of all government-sponsored COVID-19 vaccines in the country. And a part of their mandate is to have a robust community engagement strategy because they understand that science is only as effective as the people who are willing to participate in it, right? And so we can have a vaccine that's 100% effective, but if nobody wants it in their arm, then it's just a vial on the shelf. And so there've been significant investments made in community engagement. Again, I specifically am tasked with engaging faith communities because we understand that faith leaders still have tremendous equity in communities and reach with networks. And really, my mandate is just to educate and offer information so that people can experience informed consent about whether or not they participate in the vaccine for their families or not. My role is not to endorse a vaccine or even to reject a vaccine. I'm perfectly fine with people comprehending the information that is available to them and then saying, I understand all of this, but even after hearing it, I still don't think this is something right for me and my family. I'm okay with that. What I'm not okay with is people saying that they're not participating in the vaccine either based on misinformation, bad information, not enough information, or no information at all. And so for faith leaders who are on the call, I think the greatest thing that you can do is continue to facilitate opportunities like this for your membership to be able to access the information that they need from trusted messengers, right? It's not just the message, but it's also the messenger, right? Mm-hmm. And so, you know, we talk about the disparities among communities of color. You know, people who don't look like Bishop Smith and I can go in communities of color with the exact same training, the exact same information, and they wouldn't be received the same, right? So it's not just the message, it's also the messenger. And so we're being willing to create access to both and one of the places you can do that is preventcovid.org, which is the website for the COVID-19 Prevention Network. And you can specifically access their community engagement strategy under the About Us section to see how they're engaging communities all around the country so that we make decisions about our futures as it relates to our public health together, right? So then that other people aren't making decisions on behalf of specific communities. There are also a number, there's a toolkit that's available that Ashanti, after this talk, I can email you the toolkit that everybody can access. And it has marketing and branding materials that you can make your own, that you can share with your members and your congregations. And so the information is out there, and I'm sure Bishop Smith has a wealth of other resources that might be useful.
Yeah, one that I would recommend, I think that what you've said is really important, Dr. Burley, that we're not trying to endorse vaccines, endorse whatever. We're saying that this is an urgent, critical issue. I would like to say this. Okay, so the #1 medical journal in the world is the New England Journal of Medicine, recognized around the world. Go to their editorial page from October. It's very sobering, and the title of their editorial is, and these are top scientists. They don't get into politics. They don't get into ideology. And the title of the article was this: "Dying in a Leadership Vacuum." This issue in our country, whether we like it or not, is an issue of leadership. Go to anybody's website that's reputable and ask yourself, how many Americans have died from COVID? How many Americans have contracted this disease in a country that has the greatest economic, scientific wealth in the world? We're dying because we did not approach this thing correctly. We denied the science, and it has almost killed what has killed too many of us. You're going to see those coming out in papers now across the country. Back in March, it was a prediction we should lose 40,000 Americans in a year. We all were just horrified. 40,000 Americans, that's ridiculous. Well, guess what? We've lost 470,000 Americans.
Wow. So
my point is that this is an issue of misinformation. So you're right. I think that pastors and faith leaders should do that. The CDC, although it's had some tarnishing, and he's given some other. There's one that I love called there's a site called Black Idea Coalition. Black Idea Coalition. It is top of the line. It is non-denominational, but it targets faith leaders, and they feature people like Dr. Corbett, who is a Black young woman, 35 years of age, who owns the first 4 patents on the mRNA vaccine. She's a Black lady, a young sister. They are the top experts. They utilize her, they utilize people in the Black community from Howard and from Meharry and all the Black colleges who tell you they know the science. Here's the facts. And they're people of faith. These are not fly-by-night people. They're trusted voices. The NMA, which is the Black and brown arm of the AMA, who has more doctors and scientists of color than any other group, will give you point by point the vaccine issues and the issues of risk to all of us. So it's from a perspective of trusted voices that are not new. I am really appalled at the church in general, who has sometimes bought into these conspiracy theories that really are horrendous and are being tolerated in our Congress. Things like Bill Gates did this to put nano something in a vaccine to track you. And Christians are going for that. I'm going, what Bible have you been reading? So I think we've got to stop being resistant to real truth. Why would you believe that there's a conspiracy when all comers are dying? Who's conducting the conspiracy? What are their names? How did they do it? It's amazing. But again, the people in the pipeline about these vaccines, you're going to find out many of them look like me. Smart folk. Yeah, people that have studied virology and epidemiology for 20 years. So this thing about they're trying to kill us, if they're trying to kill us, they're doing a good job because we're dying. We need to stop the issue of death among all people. Again, I'm going to go to Counselor Family, who unfortunately has suffered a death in a few minutes. But I'll tell you this: truth is what we need. The Lord Jesus said, "Know the truth, not your feelings, not your political view. Truth. If you say the truth about this vaccine and about this epidemic, you'll find out that we can help one another if we utilize what we know. If we go by our feelings, I'm afraid we're going to be behind the 8 ball again, and it's not good." So I'm going to leave in a few minutes, but I want to thank you all for your patience in listening to me this morning, for all you guys that work so hard for people across the country to make them better. We've got to deal with this, and beyond this pandemic, we must deal with the church's stance about justice and ethics. If we don't do that, I think the wake-up call of the pandemic has been lost on us.
Yeah. Bishop Smith, thank you for coming and spending your time. If you got 2 minutes, I just want to ask you this one question before you have to leave, and that is this. What would you say to the church leaders and pastors who are contemplating what it looks like to reconvene? I know that's a kind of long question that we could have spent more time on, but just as a word of advice, how should they engage that process? Are they considered frontline workers to even get the vaccine? What are some things they should be considering as they prepare?
And Shante, you're not being fair with me because you're asking real good questions.
I know.
Yeah, I was on a call with the city 2 days ago, and I told them what I've told them for 6 months. How can you not have pastors designated as essential workers when people that drive trucks are? Yeah, I think that we could have done a better job with handling this if we would have designated faith leaders as frontline, because when congregations, whether they're Christian or Jewish or Muslim, when they see their leaders having access to these things, they are trusted individuals, and it allows the people then to say, okay, I can do that. So I think that one of the issues has to be, we did not do a good job in the communication of importance. Some states in Indiana, pastors were essential workers 6 months ago. In Illinois, that's not the case. So I think that's a mistake. But in answer to your question, there are ways to reconvene our church gatherings, and we've done it here, but we do it systematically. We follow all mitigating practices and protocols, and we ensure that people are safe. We met from August up until November, and our senior said, we come because we know you're going to take everybody's temperature, we're going to sit appropriately, we're going to do A, B, and C. When the infection rate went up the middle of November, to be consistent, we stopped it we're going to go back again very soon. But you can do it safely. You don't have to call our church, but there's many churches and others that have the information to help pastors to mitigate, again, the issue. Early on, I said to the government that I don't really like it that they were shutting down churches and weren't shutting down bars. Mm-hmm. So I've got a perspective from our viewpoint that we can do it properly and not put ourselves at risk. But I think that we can also understand where churches must come up to par and do the right thing by their people. Go to our website. There are others. My staff is always available to anybody. We don't charge. If you call me or call our church, we'll tie you into the right people with the right resources, because I believe the body of Christ should be thriving through this pandemic and not just surviving. So yeah, I think you can open with wisdom, but the wisdom is what does he say in Proverbs? Wisdom is a principal thing, therefore get wisdom. And all that getting, you must get a proper understanding. It's critical.
Well, Dr. Bishop Horace Smith, I appreciate you. Like a veteran, you were able to answer it even in the final hour. So I appreciate that, sir.
I've got to take care of a church that lost their pastor and their family is here.
Yes.
But any other time you want me to join with you, I'm willing to do it. You're doing a great job. Thank God for Together Chicago. Thank God for the Chicago Partnership and all those who are trying to reach out with wisdom and with faith. Our faith will make us whole. So bless all of you. I do have to go, but I'm glad to be.
Thanks, Bishop.
Bless you, Bishop. I just wanted to know, was there anything, kind of any final thoughts that you wanted to share to the community that's listening at hand?
Yeah, first and foremost, Bishop Smith had mentioned clergy not being considered essential. I think that has changed just in the last 5 days in Illinois. Clergy have been included in 1B, and so the 1B eligibility, which are people who are eligible right now. So wherever you get your health care from, call them, let them know that you're a clergy and ask them, are you eligible to receive the vaccine? Because I do know persons who are clergy who have been able to do so since the change went into effect. But the change has been so quiet that sometimes even the facilities, the staff persons at the facilities themselves haven't been made aware of it yet. So people have been calling and staff persons have been saying, yeah, no, that's not true. And then somebody at a higher pay grade follows up and said, well, it is true. Come on in and we'll get you taken care of. And so all of you clergy, faith leaders, if you are interested in getting the vaccine and haven't done so yet, I would encourage you to do the research within wherever you get your healthcare from. Also, beginning this week, pharmacies like CVS and Walgreens are going to start making the vaccines available, and you should be able to make appointments via the applications or online as well. But again, as long as supplies continue to be limited, getting a vaccine, if you're not somebody over the age of 65, is going to be a dice roll, probably until this summer. There is one more candidate, the Johnson & Johnson vaccine, which is a single dose vaccine that is expected to apply for emergency use authorization this week. And so if they apply and the FDA grants them emergency use authorization within the next month, we'll have one more vaccine candidate available to us in addition to the two that we've already had since December that will hopefully bolster the availability of vaccines in our country. And this particular vaccine, again, is one dose. It's not an mRNA vaccine. It's a viral vector vaccine. So it's more of a traditional platform that we've used in the past. And so some of the temperature considerations that we've been worried about with the mRNA vaccines don't exist with the Johnson & Johnson vaccine. And so that means that for places that don't have the infrastructure to store the mRNA vaccines at an extreme temperature, like FQHCs and community health centers and pharmacies, those places will be able to have the Johnson & Johnson vaccine and be able to reach those more underserved populations that haven't been able to access it. And so, better times are ahead is my hope. To Bishop Smith's point, time won't change much in terms of it just more so what we know. And I won't give people a time as to when we might be out of this, but we do know that a part of it is getting as many folks vaccinated as possible. And so, if your turn comes up, my recommendation would be to strongly consider not missing that turn, because if you do, somebody else will take your turn, and it's likely somebody who maybe isn't as at risk as some of the communities that we've been ministering to, particularly Black and Brown communities. So, really thankful for all of you all for being willing to listen and engage in these conversations about faith and how it intersects with science and public health. And as Bishop Smith says, I continue to be a resource for each of you. And Ashanti has my email. There are other COVID-19 Prevention Network faith ambassadors, not just me. There are 7 of us that cover the country right now. And so, I might not be the person that you want speaking to your people, but maybe somebody within our network is. And so, reach out and we're available.
Yeah, well, again, thank you, Dr. Burley III, founder of You Be the Cure. He's also, again, working with the COVID-19 Prevention Network, and we'll provide information regarding all the stuff that you heard today as we send out details post-event. But I just want to encourage you guys, again, to stay connected with us here at the Chicago Partnership. Next month, we will, again, be having a conversation topic. We'll be letting you know soon, but that's going to be on Wednesday, March the 10th. Same time, 11 a.m. And we look forward to seeing you there. But we want to also remind you that we've got food boxes. We'll be receiving 1,000 food boxes with meat, vegetables, and dairy weekly for the next 2 months. So if your church would like to assist in distribution of these food boxes in your local community, or a community that you know of that could be in need, that you could do that, definitely email Brian Dye. You can email him at brian@thechicagopartnership.org. And if you don't remember that, just go to our Chicago Partnership website. You'll see his contact information. And again, it's a great way to be able to service the community, even if it's not your direct community, but be a helping hand and be the hands and feet of Jesus in the city of Chicago. So again, we thank you for today, joining us and spending the time. And as always, we send our love to you, and I look forward to doing this again. God bless you all.